she's going to tell her story. I don't want to steal her thunder on this, but I always get my eye makeup ruined, so I went to CVS and got waterproof mascara this morning because this detox product, I know AJ said it's a probiotic, this detox product has changed the lives of literally hundreds of people now that I personally have heard of with ADD, ADHD. We have so many great testimonies on mercury poisoning and incredible stuff.
Not a medical claim.
Not a medical claim.
Not a medical claim.
But I have testimonies. We have personal stories of people having remarkable results. And so this one is one of my nearest and dearest to my heart. So, you both. Scott.
Okay, so I'm going to start off with my husband first. I think it's really important that you understand who's Scott Cook. He's the one that did all the work for you. So Scott's not here today because he's actually in Singapore, and he's actually looking at medical device and regulations for a company to actually come here into the state of Massachusetts. So we didn't get into a direct marketing company before. As a matter of fact, when I went home and told my husband that we got involved in this company, he freaked out. Why? Well, I'll tell you a little bit about who my husband is and the impact that he had and what he's done for all of you. So Scott, on a Friday, I came home and told him that we signed him. He freaked out, and he said, no way, I'm going to lose my job and my credibility and my reputation. You know, these guys are just mixing this up in the garage and putting a label on it. And no. And I said, look, you know the people to call your peeps, get on the phone. I'm not emotionally attached to the company yet. Do what you need to do, and then just tell me a yes or a no. Don't drag it out. He spent 4 days what I call him the cellar in the cave. It was a weekend. And what he did for you is he literally read every single one of Dr. Lehman's papers from beginning to end. And then it wasn't enough. So then he got on the phone on a Saturday and called Derek Hall and said, I know you're the CEO of a multi-million-dollar company, and this is Saturday, and I just signed up and you don't know who I am, but please justify to me what you're doing with your good laboratory practices and your standard operating procedures, because I need to know that these are safe, ethical products and that you're doing the right thing before I can bring it out to, even consider doing it. Derek Hall on a Saturday in the middle of the night, who doesn't know who Scott Cook is, took the time to answer all of his questions about him coming into this business. And that wasn't enough. So what did he do? He called up Justin Banner on Sunday. Justin Banner gets on the phone with him and starts answering all his questions. What are they talking about? The labeling, the packaging, the regulatory requirements that our products actually have to meet the regulatory industry. If we were ever regulated today, Qivana's not going out of business. Everyone else is, but we are way ahead of the curve when it comes to regulation. So we also go one step further. Third party, outside credible auditors that come in and make sure that every product that comes off their line has the same ingredients, the same quality, the same potency, the same everything process. So every box is exactly the same. That's what the pharmaceutical industry does. We are way ahead of what the natural products industry is doing. We're reorganizing it, we're coming in, and we are doing something that no one's ever seen before.
You did not in one thing. Please say what your husband's
So
title is.
in the clothes, right? So in the clothes, now they've got you on the edge of the seat. So who is this guy? So here's what Scott does. Scott is the last 20 years has been the Senior Regulatory Compliance Officer and Quality Assurance Director for the pharmaceutical industry. He works with the FDA. Anything that you go by at CVS, he's looked at, touched, and made sure that it's safe and ethical for you to get out. He's been a research developer for a long time. He's actually just recently been elected as the Vice President of Global Society of Quality Assurance for the pharmaceutical industry. He's over in Singapore right now looking at something to bring back here to the United States. He could not be here today, but I will tell you, Scott and I are 100% invested in this company. And why? Because of a lot of things, but most importantly, this product right here, and I will cry every time I tell the story. So here's the deal. To all the mothers out there, when you're desperate and you have nothing else to lose, you go for whatever it takes. So here's the long and short of my son Tyler. My son Tyler was 5 years old, 4 turning 5 when I came into this company. At 3 years old, we noticed major behavior changes with Tyler. We noticed that he could not make a decision between milk and water without a complete and total meltdown. He could not sit down and eat a meal at his table. He could not read a book at story time with me. He was aggressive. He was angry. How does a 3-year-old to 5-year-old little boy get depressed in a very safe household? So we recognize that as a physical therapist, and my husband obviously background, we recognize it as a chemical imbalance in Tyler. He was too young for objective testing in the health industry. Believe me, I'm in healthcare. And I said, I don't care, do the test. No one would do it. We paid cash out of our pocket to show them that he was off the charts. He was way left of every standard that there was. And they needed to do something to help a desperate mother. What do you do? Everything. Doctors, psychiatrist, psychologist, don't tell me no, give me a solution. I have a 4-year-old who said that, and there's no justification for it, it's a chemical imbalance. We tried every drug cocktail under the sun. I paid $300 a month cash out of my pocket to find the right drug. He still went through withdrawals every single night, and on the weekends it was awful. He didn't like being in his own skin. So as a mother, desperate, Qivana had come into our life in February. This was all happening before he entered kindergarten, and I swore I needed to find something. He got sick on a Thursday, he had the flu, we could not give him his prescribed medication. By Saturday, I was calling everyone on the sun in Qivana, crying my eyes out as a desperate mother, because I could not put him back, because the withdrawal was so bad, Scott and I had to protect him like he was having a grand mal seizure. No more pharmaceuticals. We find out about the Detox product, it's in my house. I said, okay, we sat on the floor and begged. I bought him toys that, give him donuts, buy him toys, whatever it took, right, to get it in him. On day 1 we did it, on day 2 we did it, on day 3 we did it. On day 4, my son Tyler, on the Qivana Diet Detox product, nothing else. Say good morning, Mom. Oh. On day 5, he came down the stairs singing. On day 6, he could eat a meal. On day 7, we could read a book from cover to cover. By day 10, and my family members are here, and I will tell you, I got my little boy back. And it was 100% because of these words. My husband has stopped research for you. You want to go read 90 peer-reviewed authored medical journals? Go to that. Dr. Lehman on the Atlanta Strip sat with my husband Scott. They were drawing all kinds of colds and compounds, things that you couldn't imagine. They talk the same language. Just know Scott's done his due diligence for you. The products are safe and ethical, and my son is a testimonial of what you want. Oh.